is there a way to do the tummy tuck without the long incision all the way across?
So when it comes to tummy tucks, we do 3 different kinds. They fall into 3 categories. One is a mini tummy tuck, one is a standard tummy tuck, and one is an extended tummy tuck. Most women fall, if you're not a massive weight loss patient, you'll fall in the middle and need a standard tummy tuck. Let's start with the mini. There's a small percentage of people who do need a mini. The mini tummy tucks are smaller incisions, very similar to a C-section incision, but the only thing that it addresses is the laxity from the navel down to the pubic area. So there's no abdominal muscle tightening. It only addresses that skin. So it's really designed for women who've, with pregnancy, they just have a little pooch or shelf or whatever they call it. You pull down 4 or 5 inches of an incision, that's it. I mean, it's such a minor procedure that it can be done under local anesthesia as well. But most women don't fall into that category, unfortunately. Because with pregnancy, as you and I know, having had 3 kids, the abdominal muscles will stretch. They never quite go back to where they, were before.
Abdominal hernias are very, very common as well with pregnancy and massive weight gain and weight loss.
That can be repaired during the tummy tuck. But the only way to be able to give you a full correction is with an incision. And that's because following pregnancy, our skin stretches and skin will not contract. This is the same concept as with weight loss patients. When they've gained a lot of weight, that skin doesn't go back. There's no magic wand, there's no laser, there's no device that's gonna be able to tighten your muscles internally the way that needs to be after pregnancy and to remove the skin. So to answer your question, absolutely not, unfortunately. But this is where it's important who you choose to go to. If you choose the right doctor, the incision will be placed so meticulously, as Dr. Agha's are, so low. I've had a standard tummy tuck, and I contemplated the mini and the standard. I could have done either, but obviously I got a better correction with the standard tummy tuck. And I can wear almost any bathing suit bottom that I want to wear with no problem because of where my incisions are placed.
One thing to also remember is Dr. Agha's tummy tuck incisions is usually 1 to 2 inches lower than any other standard plastic surgeon's incision. He ensures that it is super duper low, so the tiniest bikini, tiniest thong will cover your incision.
So if patients really worry about scarring, it's kind of like a give or take, right? Yeah, there's going to be a scar, but the whole area is going to be corrected and the scar will be easily covered. Yeah. So that's a choice you're going to, have to make. The extended tummy tuck, really quickly, is one that's mostly designed for people who've gained and lost a lot of weight during pregnancy or weight loss patients. And that incision doesn't end at the hip where the standard one does. It extends about 3 to 4 inches back on each side to be able to get that extra skin in the back area so that there's a smooth transition from the front to the back without having a muffin top, hanging on the back side.
One other thing about the extended tummy tuck, it also gives you a little bit of that outer thigh lift as well.
It's an enhancement. We don't call it a lift, but it can enhance the outer aspect of the thigh.
Totally.